Hello everyone. Today we will be talking about appendicitis. Appendicitis is basically an inflammation of the appendix, which is a couple of inches of tube of tissue that extends from the large intestine. And it usually results from obstruction, inflammation, and definitely an infection. Okay? Now, appendicitis is a medical emergency, which means that you need surgery to remove the appendix, okay? And if left untreated, an inflamed appendix will eventually burst, or what we call perforate, and it can spill infectious materials into the abdominal cavity, which can then lead to peritonitis, which is a serious inflammation of the abdominal cavity lining, and this can be fatal, okay? Now, let's look at the symptoms of appendicitis. Now, dull pain near the navel or upper abdomen that becomes sharp as it moves to the lower right of the abdomen is usually the first sign, okay? So for the NCLEX exam, try to remember what we call McBurney's point, which is basically the name given to the point over the right side of the abdomen that is 1/3 of the distance from the anterior superior iliac spine to the umbilicus or the navel area of the body, okay? And basically this point roughly corresponds to the common location at the base of the appendix, okay? Where it kind of connects with the cecum, right? Now, also there would be, for more symptoms, there would be a loss of appetite, there would be nausea and vomiting, definitely abdominal swelling, and there can be a fever, a high fever, and severe abdominal cramps, okay? So how do we diagnose our patients with appendicitis? Well, it can be sometimes tricky because the symptoms of appendicitis, like I mentioned before, are frequently very vague and very extremely similar to other problems. So several tests are going to be usually used to help make a better diagnosis, and that includes abdominal exam to detect the inflammation, right? There would be a urine test to rule out a UTI or urinary tract infection. The physician can also do a rectal exam, and a blood test can be done to see if there's an infection in the body, okay? And also a CT scan or ultrasound will also be done. So how do we treat our patients with appendicitis? Like I mentioned before, surgery is going to be needed to remove the appendix, and we call this appendectomy, and it's the standard treatment for almost all cases of appendicitis. Now, generally, if appendicitis is suspected, the doctor will quickly remove the appendix to avoid the rupture, right? And if the appendix has formed an abscess, you may have two procedures that can be done. One is to drain the abscess of pus and fluid outside the body, and the other one would be to remove the appendix. So those are your only two options. Now, remember, with appendectomy, antibiotics are given before appendectomy to fight possible peritonitis or other infection, and general anesthesia would usually be given. And nowadays, usually the appendix is removed through laparoscopy, which is just a 4-inch incision done in the stomach. Now, after the appendectomy, post-op, as the nurse, you got to make sure to watch the patient for signs of an increased pain in the abdomen, or especially blood in the vomit or in the urine, redness in the incision area, or a high fever, because any of these signs can trigger a major issue. Therefore, the physician should be prompted as soon as possible, okay? Now, this is just a quick short review. Thank you so much for watching. I really do appreciate it. About GERD, or gastroesophageal reflux disease. So, gastroesophageal reflux disease, or GERD, is a digestive disorder that affects the lower esophageal sphincter, or LES, which is basically the ring of the muscles between the esophagus and the stomach. And basically, what occurs is that stomach acid or stomach content, there would be a backflow into the food pipe, or what we call esophagus, due to a weakened esophageal sphincter. Okay? Now, the backflow or the reflux can irritate the lining of the esophagus and causes you to have pain, and that's what GERD is. Okay? So again, there's basically an inappropriate relaxation of the LES muscle, or the lower esophageal sphincter, right? Which is the ring muscle between the esophagus and the stomach, therefore causing the backflow of GI contents up into the esophagus. And the gastric acid and the pepsin can cause tissue injury within our esophagus, and this can result in what we call Barré's epithelium or Barré's syndrome. So what is Barré's epithelium or Barré's syndrome? It basically refers to the abnormal change, which is what we call metaplasia, within the cells of the lower portion of the esophagus, and this occurs due to the backflow of the gastric acid and the pepsin, and it's usually characterized by the replacement of this what we call normal squamous epithelium lining within the esophagus, and it becomes replaced with simple columnar epithelium with goblet cells, right? And basically these goblet cells are usually what is found in the GI tract. And the problem with this is that this can be a medical issue because there's a strong association with Barre's esophagus or Barre's epithelium with esophageal adenocarcinoma, which is basically esophageal cancer. So basically, this can be considered a pre-malignant condition. Okay, so we need to be aware of this. So how do we assess our patients? We can see that the patient might have heartburn or what we call dyspepsia, and the pain can be up and down the chest region. There can also be regurgitation, so we gotta monitor for crackles in the lungs because the patient can be a risk for aspiration. Okay, there could also be hypersalivation and dysphagia. Now, dysphagia could be due to the narrowing of the esophagus, so the constricting of the esophagus can cause dysphagia. Okay, now let's look at the treatment for our patient. We can administer antacids because what it does is it neutralizes the acidity in the stomach, and examples could be Mylanta and Maalox. We could also give the patient PPI or proton pump inhibitors, and this reduces the production of acid again. Main drugs that you might encounter in the NCLEX can include lansoprazole and omeprazole. Okay. Lastly, another group of drugs that we can give our patients are histamine H2 blockers. And again, these can also help neutralize and decrease the production of acid in the stomach. Now, like I said before, guys, I'm just going to make this short and sweet. And I will go over more of this diseases in the next few videos. Again, thank you so much for listening, for watching. I really do appreciate it. I wish you the best in your NCLEX exam. I know you guys will do great. Thank you so much. God bless. Bye-bye.